Good morning, everyone. In this PowerPoint presentation, we will cover the topic hypertension. Hypertension. For an adult client, hypertension occurs when the systolic blood pressure is at or greater than 140 or diastolic pressure is at or greater than 90. And this will be for two or more assessments of the patient's blood pressure. Remember, for older adult patients that are greater than 60, their blood pressure should be equal to or less than 150 over 90. Now you have essential hypertension, which is also known as primary hypertension, and this generally accounts for most cases of hypertension. Evidence-based research shows that there is no known cause of essential hypertension. Secondary hypertension can be caused by disease processes such as kidney disease or as an adverse effect of different medications. Treatment for secondary hypertension occurs by removing the cause. So if the cause was a medication, we would discontinue that medication. Patients who have a systolic blood pressure of 120 to 139 or a diastolic pressure of 80 to 90 are considered to have prehypertension. Remember, with prehypertension, you always want to educate your patient about lifestyle changes that are necessary to help these clients prevent any further cardiovascular disease. Now remember, when you have prolonged or hypertension that is not treated, it can cause peripheral vascular disease. And remember, this has bad effects on your heart, your brain, your eyes, and your kidneys. It also puts you at risk for developing complications to increase as your blood pressure increases as well. Health promotion and disease prevention is very important. You want to make sure that you always educate your patients. A big thing that you want to educate them on is limiting sodium and fat intake. If you have a patient that is a smoker, you want to encourage them to stop smoking. There are different type of classes that you can go to for smoking cessation. So if you have any resources available, you want to make sure that you give that information to them. You also want to use stress management techniques during time of stress. You want to teach them about limiting caffeine and alcohol intake. Remember, your patients who are diabetics, you want to make sure and educate them about that they should keep blood glucose within a recommended reference range. Remember, you always want to teach them about their weight as well. You want them to maintain a body mass index of less than 30. Also, we want to teach them about exercise. Exercise is important. You want to make sure that they engage in exercise that provides aerobic benefits at least 3 to 4 times a week. Risk factors for essential hypertension are positive family history, excessive sodium intake, physical inactivity, obesity, high alcohol consumption, being an African American, being a smoker, having a history of hyperlipidemia or high cholesterol, stress, and an age greater than 60 or postmenopausal. Some risk factors for secondary hypertension is kidney disease, brain tumors, medications such as estrogen or steroids, and pregnancy. Blood pressure is classified by the following classifications. With expected, your systolic blood pressure is less than 120 and your diastolic is less than 80. With an elevated blood pressure, systolically, you're looking at 120 to 129 and diastolically less than 80. Stage 1 hypertension is when your patient has a systolic blood pressure of 130 to 139 or a diastolic blood pressure of 80 to 89. Second stage hypertension with systolic is equal to or greater than 140 and diastolic equal to or greater than 90. When taking your patient's blood pressure, you want to make sure that your patient has not smoked, exercised, or ingested any type of caffeine within 30 minutes before the measurements. Remember, you want to seat your patient with their legs uncrossed and their feet should be flat on the floor. You want to make sure that you begin the measurement after the patient has rested quietly for at least 5 minutes if they have been up, moving around, walking back and forth. You want to make sure that you use the right cuff size and follow the instruction to fit in placement according to the manufacturer's recommendation for the cuff. Now remember, if you use a cuff that is too large or too small, it can give an inaccurate reading, so this is very important. You want to make sure that you measure and record the blood pressure in both arms initially and note any differences. If there are conditions when extremities should not be used for blood pressures, you want to make sure that you take this into account. For example, if you have a patient who has had a right mastectomy, meaning that they have had their right breast removed, we want to make sure that we do not do any sticks or check blood pressures on that right side. Depending on your facility's policy, a lot of times they will use a pink sleeve to indicate that blood pressures or sticks should not be taken on that side. So you want to make sure that you know that. It's very important. With hypertension, your nursing assessment is very important. That's subjective data and objective data. It's very important to make sure that we get information about the client's past medical history. We want to make sure that we ask them about their past workup of high blood pressure. Do they have any other cardiovascular disease processes? We want to find out if they have any past history of renal or thyroid disease. We want to ask this patient, are they a diabetic? We want to assess if they are obese and check their BMI. We also want to ask them about history of menopause or hormone replacement drugs. Medications are another one that's very important. Remember, we want to ask them about the use of any prescription medication, over-the-counter medication, recreational drugs, as well as herbal drug therapy. We also want to ask this patient if they are currently taking antihypertensive drugs, okay? And we're going to talk more about different antihypertensive drug therapies in just a second. Also, we want to ask them about their health management and their health perception. We want to find out if they have a history or a family history of hypertension. We want to assess if this patient smokes or drinks alcohol. We want to ask them about their lifestyle. Do they exercise? One big thing that you want to assess for while gathering this data is the readiness for change. Will this patient be compliant in their therapy? We also want to ask them about their elimination or their urination. You also want to ask the patient, did they have any symptoms of dizziness, blurred vision, erectile dysfunction? We also want to assess their coping and their stress tolerance. We're going to want to ask them about their occupation, about their home life, or any stressful life events. Now, when we go to objective data, of course, we want to get our blood pressure. We want to find out if our patient is hypertensive or has hypertension. We also want to assess our patient's heart sounds. We want to make sure that we listen to them with our stethoscope and report any abnormal findings to the physician. We also want to check our pulses for our patient. We want to check if they are obese or if they have a BMI of greater of 30. We want to assess our patient's mental status or our neurologic system. Drug therapy for hypertension can include your diuretics. You may hear your providers or nurses or your patient refer to them as water pills because they help rid the body of salt and water. Now you have different type of diuretics. You have your thiazide diuretics such as hypochlorothiazide. You have your loop diuretics. An example would be furosemide or Lasix. And you have your potassium sparing diuretics such as spironolactone. Now, it's very important to make sure that you monitor the patient's potassium levels. You want to make sure that you educate your patient to report or watch for any muscle weakness, irregular pulse, or dehydration. Your thiazide and your loop diuretics can cause hypokalemia, and your potassium sparing diuretics can cause hyperkalemia. So you want to make sure that you educate your patient to keep all appointments with the provider because it's important to monitor these electrolytes while taking the medication. Remember, if they are taking a potassium depleting diuretic, that you want to make sure that you educate them to increase the consumption of potassium rich foods, and bananas is a really good example of a food that's high in that potassium. Calcium channel blockers are another drug therapy that's used for hypertension. Some examples would be your amlodipine or your Norvasc, your verapamil or your daltalzam or that cardizem. And those drugs alter the movement of calcium ions through the cell membrane, causing vasodilation, and this hence lowers the blood pressure. Now, it's very important to make sure that you monitor your blood pressure and pulse for this patient. You want to make sure that you change position in this patient slowly, because hypotension is a common adverse effect of this medication. You also want to make sure that you use calcium channel blockers cautiously with clients who have heart failure. Now, when you begin teaching your patient about medication, you want to make sure that you educate them that constipation can occur with your verapamil. So you want to make sure that you increase your water intake and make sure that you increase your intake in foods that are high in fiber. Also, remember that with this type of medication, a decrease or an increase in heart rate or an AV block can occur. So you want to make sure that you take the patient's pulse and you call the provider or have them to call their primary care provider if they have an irregular or a lower than normal rate. You want to make sure that you tell them to avoid grape juice as well with this type of medication, because it potentiates the patient's medication effects to be greater. Okay. And also, grapefruit juice can increase the hypotensive effects and increase the risk of medication toxicity. So you want to make sure that you educate your patient on this medicine to avoid grapefruit juice. Another example of drug therapy for hypertension will be your ACE inhibitors or your angiotensin converting enzyme inhibitors. Now, examples of these will be your prils like lisinopril and enalapril, and they prevent the conversion of angiotensin 1 to angiotensin 2, which prevents that vasoconstriction. Now, it's very important with your ACE inhibitors to make sure that you monitor blood pressure and pulse as well. Hypotension is a common adverse effect. You want to make sure that you monitor for evidence of heart failure, such as that fluid or that edema in their extremities, as well as in their abdomen. ACE inhibitors can also cause heart and kidney complications, so it's important to make sure that they keep all follow-up appointments with their physicians. It's important to make sure that you educate your client to report any cough that they may have while taking this ACE inhibitors, because that's an adverse effect. You also want to teach them that they can have an occasional relationship to angioedema, and that is when your patient has swelling of the tissues under the skin, and it typically affects the lips, the tongues, and your glottis, and it can progress to a life-threatening obstruction. So you want to make sure that they know about angioedema with these ACE inhibitors and they know when to call and get help. Also, you want to make sure another example of drug therapy is your angiotensin 2 receptor antagonist. They are also known as ARBs. Providers may say ARBs. That's ARBS. And these medications are meds such as your losartan or your valsartan, and they are good options for patients taking ACE inhibitors who report a cough or have hypokalemia. Now, nursing actions and interventions is very important to make sure that you monitor this patient with taking ARBs for angioedema and heart failure as well. Angioedema is serious, but is an uncommon adverse effect with this type of medication. You want to educate your client to change position slowly. If they have any findings or symptoms of angioedema, you want to make sure that they report those to their primary care physician. Also, you want to teach this patient to avoid foods that are high in potassium and have potassium levels monitored, because your ARBs can cause hyperkalemia. Another example of drug therapy for hypertension can be your aldosterone receptor antagonist. And an example of this will be your spirulactolone, and it blocks that aldosterone action. It's very important to make sure that you monitor kidney functions, triglycerides, your sodium and your potassium levels. The risk for adverse effects increases when the kidney function deteriorates. So you want to make sure that they know the importance of keeping follow-up appointments so we can check these electrolytes. Hyponatremia and hyperkalemia can increase as the dose increases. So you want to make sure that they are monitored very closely. You want to monitor that potassium level every 2 weeks for the first few months and every 2 months thereafter. The client should avoid taking potassium supplements or potassium sparing diuretics while on this medication. Now you want to educate your clients to be aware of any potential food, medication, or herbal interactions. Remember, grapefruit juice and St. John worts can cause adverse effects. Now, your patient may currently take St. John's worts for menopause symptoms. Any ADHD or depression is a common herbal drug that is used. So you want to make sure that you educate your patient to not take that while taking this type of medication. Also, you want to educate them not to take any type of salt substitutes with potassium or other foods that are rich in potassium. Another drug therapy used is your beta blockers or your LOLs. An example would be metoprolol, atenolol, labetalol, and these medications work by blocking the sympathetic nervous system and ultimately produces a slower heart rate and a lower blood pressure. It's very important to make sure in your beta blockers that you monitor the pulse because it can lower your pulse as well as your blood pressure. Now, it's important to make sure that you educate your client about the medication and its adverse effects. Remember that these medications can cause weakness, fatigue, sexual dysfunction, as well as depression. It's very important to make sure that you tell your patient, do not suddenly stop taking this medication. You want to make sure that they consult with their provider, which will taper them off of the medication. And stopping this medication abruptly or suddenly can cause rebound hypertension. So we do not want that to happen. Beta blockers can also cause some manifestations of hypoglycemia as well as tachycardia. So you want to make sure you monitor this patient very closely. An example of a central alpha 2 agonist drug would be clonidine, and this medicine works to reduce peripheral vascular resistance and decreases blood pressure by inhibiting the reuptake of norepinephrine. It's very important to make sure with clonidine that you monitor blood pressure and pulse. Generally, this medication is not the first line choice for hypertension. It may be added or needed after a patient has tried another medication of choice. You want to make sure that you educate this client about adverse effects, including sedation. They may have that orthostatic hypotension as well. Another example will be your alpha-adrenic antagonist. And examples of those would be your digoxin and your prazosin, and they reduce blood pressure by causing vasodilation. With this medication, it's very important to make sure that you start the treatment with a low dose of the medication. It's usually given around nighttime. You want to make sure that you monitor the blood pressure 2 hours after the initiation of treatment. Very important. Also, you want to make sure that you educate this client to rise slowly to prevent postural hypertension. And they also want to use caution when driving until the effects of this medication is known. You want to make sure that you educate your patient about the compliance of follow-up appointments. It is very important to make sure with all of these medications that you come to your doctor's appointments to have labs drawn and to get your vital signs. When we talk about client education, it's important to make sure that your client knows to report any manifestations of electrolyte imbalances, such as that muscle weakness that we talked about. We want to make sure that the patient understands the importance of adhering to their medication regimen and is agreeing to comply with this medication. You want to make sure that your patient understands their prescribed medication, and you want to go over the different adverse effects of these medications. If you have any resources available that can help with your patient's pay or copay for medication, it's very important to make sure that you let them know that resources are available if they need. You want to make sure that your patient understands the importance of doctor's appointments and the importance of monitoring their heart and their blood pressure. Also, we want to talk to them about keeping a blood pressure log at home, okay? We want to see if this medication is working that they are prescribed, or if we need to add a different medication or change the doses of these medications. Remember that older adult clients are more likely to experience medication interactions and more likely to experience that ortho hypertension. So you want to teach them about risk of falling. We do not want our older adults to fall. Also, we want to educate them about making different lifestyle changes. It requires them to cut back on the type of foods that they eat. We also want to teach them about stress reduction, taking deep breaths in and out. If it relates to a job, they may need to get another job if they cannot find different strategies to reduce that stress from their occupation. When we talk about nutrition, we want to make sure that we educate our patient about the DASH diet. And the DASH diet is high in fruits, vegetable, and low-fat dairy foods. You want to make sure that you teach them to avoid foods that are high in sodium and fat. You want to educate them on dietary approaches to fight hypertension. Foods that we generally tend not to think about that holds a lot of salt or sodium is our canned foods, okay? Anything canned that you can find in the store. Also, your foods such as hot dogs, okay? They tend to hold a lot of salt, so you want to make sure that you educate your patient on the different foods. We also want to teach them about reading their nutrition labels, okay? Each nutrition labels has the amount of salt or sodium that is in that container. It's important to make sure that we educate our patient as well as our caregiver about the diagnosis of hypertension. Now, when we talk about hypertension, we want to remember some things that can go along or coexist with hypertension, such as diabetes, cardiovascular disease. Remember, if our patient has very high blood pressure, that puts them at risk for having strokes, right? So you want to make sure that you educate your patient and your caregiver on, the signs and symptoms of a stroke, such as blurred vision, not being able to coordinate, headaches, not being able to use their extremities, not being able to walk. They may not can see. They could have that double vision or blurred vision. Remember, when we talk about muscle weakness, it can be on one side of the body or it can be on both sides of the body. And I know that we haven't got to neuro yet to talk about strokes, but please make sure you know just the things that I have mentioned in this PowerPoint as it relates to hypertension and risk for having a stroke. You also want to educate the caregiver about the importance of medication compliance for the patient and follow-up appointments. A lot of times our caregivers are the ones that prepare meals for the patient, so you also want to educate them about the importance of nutrition. Hypertensive crisis often happens when patients do not follow the medication therapy regimen put on by the provider. Some early manifestations can include severe headache, extremely high blood pressure. Usually the systolic blood pressure is greater than 180 and the diastolic is greater than 120. Your patient may also complain of some blurred vision, dizziness, disorientation. They may have some nosebleeds. Usually, hypertensive crisis requires for this patient to be admitted into the acute setting. They will receive IV antihypertensive medication such as labetalol. And the goal of the patient with this hypertensive crisis is to lower the blood pressure for by 20 to 25% in the first hour, but we want to make sure that we do not drop the blood pressure too low. So generally, they do not want the blood pressure to drop lower than 140 over 90. It's very important to make sure a patient with hypertensive crisis that if they are receiving any type of IV antihypertensive, that you want to monitor the patient's blood pressure every 5 to 15 minutes. You want to make sure that you assess their neurologic status, assessing their level of consciousness. You want to assess the patient's pupil as well as their muscle strength. You also want to monitor an EKG or ECG to assess the patient's cardiac status. We're going to do a few practice problems. I'm going to give you time to answer the question before I provide the answer to you. So the first question states, a nurse is screening a client for hypertension. The nurse should identify that which of the following actions by the client increases the risk of hypertension. Select all that apply, okay? So that means we're going to have more than one answer. Choice A reads, drink 8 ounces of non-fat milk daily. B, eating popcorn at the movie theater. C, walking 1 mile daily at 12 minutes per mile pace. C, consuming 36 ounces of beer daily. E, getting a massage once a week. I'm going to give you a few seconds to answer the question. All right, so the correct answer for this question is answer choice B, eating popcorn at the movie theater. Remember, popcorn contains a large amount of sodium and fat, which increases the risk of hypertension. So that is a risk. And then answer choice D says consuming 36 ounces of beer daily. Remember, consuming more than 24 ounces of beer per day for a male client or 12 ounces for a female client increases the risk of hypertension. Okay, so these are the only two correct answers. The next question reads, a nurse is caring for a client who is admitted to the emergency department with a blood pressure of 266 over 147. The client reports a headache and double vision. The client states, I ran out of my ditalazine 3 days ago and I am unable to purchase more. Which of the following actions should the nurse take first? Okay. Answer choice A says administer acetaminophen for headache. B, provide teaching regarding the importance of not abruptly stopping the antihypertensive. C, obtain IV access and prepare to administer an IV antihypertensive. D, call social services for a referral for financial assistance in obtaining prescribed medication. Now remember, in the stem of the question, it says, what should the nurse do first? So these answer choices may all be correct. You may all do this for this patient, but which one should be done first, okay? And I'll give you a few seconds to come up with your answer. Okay, and the correct answer is C. You want to make sure that you obtain IV access and prepare to administer an IV antihypertensive. This patient's blood pressure is 266 over 147, which indicates that they may be in hypertensive crisis. So remember, as we said in the previous slide, you want to make sure that you give that that IV hypertensive medication. The next question reads, a nurse is providing discharge teaching for a client who has a prescription for furosemide, 40 milligrams PO daily. The nurse should instruct the client to take this medication at which of the following times of the day? A, morning, B, immediately after lunch, C, immediately before dinner, and D, at bedtime. Now, when you go over these choices, I want you to think about the type of medicine that furosemide or Lasix is, okay? It is a diuretic. What does a diuretic do? What does it indicate? Okay? I'll give you a few seconds to answer the question, and then I will be back with the correct answer. Okay, and the correct answer is A, in the morning. It is very important to make sure that the patient who is taking furosemide or Lasix takes it in the morning. Remember, this is a diuretic, and the peak action and the duration of the medicine usually should be occur during waking hours. Okay, we do not want the patient to lose sleep because they are having to wake up in the middle of the night and use the restroom.